Osteopathy for me is a very rewarding job. I love how I get to help and support people feel better and improve their quality of life. Osteopaths have time in their sessions to really get to know our patients and what factors may be influencing the injuries or issues they present with.
One of the nice things from osteopathy is the great feeling that we get when we see somebody starting to heal and re-engaging with life, especially if they're a chronic pain patient. Acute is obviously very different because we can tend to work with them, see somebody within a week and then 2 weeks and they're back to normal as such. But it's the chronic pain patients who eventually come for osteopathy and you see the changes. It may be slower, but they'll actually start reporting back more that they're doing more exercises, that they feel happier in and of themselves. And that makes us feel better about what we're doing because we're helping them.
We will talk about all aspects of the presenting condition, how it started, how it progressed, how you may have been managing the symptoms so far. We'll also discuss things such as your work setup, exercise, nutrition, sleep, and we may even assess the shoes you turned up in to see if they're contributing to the condition.
One of the good things about osteopathy is that we actually build relationships with our patients. I've always noted and said to people that I feel as though we're privileged that we get the time that we do. In a routine osteopathic treatment, we get 30 minutes with somebody, we get half an hour. We can actually see how people react, what makes them happy, we learn their background, and we can actually see the changes with them.
Osteopaths use their hands for the majority of the assessment and treatment. We can pick up so much about how the body functions by looking and feeling how it moves. The techniques we use for treatments are gentle, and no two treatments are the same, as we will tailor every session to the individual, what they need and the best way to manage their progress. We use a range of techniques such as soft tissue release, articulations, manipulations, such as the high velocity thrusts. These are the clicks that you may have heard about. They restore movement to a restricted joint by gently gapping the joints, which is a natural movement and can release the sound like a pop. We don't use this with every patient, and we fully discuss the treatment with you before we start. There's always more than one way to treat your condition, so if you prefer not to have certain styles of treatment, you can discuss this with your practitioner. Following your treatment, you'll be given advice on things such as exercises to help you, postural advice, i.e. how to sit better at work or at home, your sleep position, and even nutritional advice.
Babies go through many different forces when they're growing and on their journey into the world. Sometimes these forces can be dysfunctional and babies can't tell you exactly what's going on when things don't feel quite right. Bringing your baby in for a general checkup is a wonderful thing after birth. We see babies for feeding issues, tummy troubles, teething and difficulty sleeping. Cranial osteopathy involves a very light touch to relieve patterns of tension and restrictions, so it's a safe and effective treatment that babies respond really well to.
One of the most asked questions is it just back pain that we treat? Well, the answer to that is no. Most people do come in with back pain, that's a big thing, but we actually treat the whole body. If we're looking at somebody with back pain, we don't just go directly to the area, we'll look at everything and see what's actually going on and work right the way through from feet right to the head. Every person who walks through the door is different, including the fact that we'll work from children all the way through to people who are up into their 90s. And you can't just look at children or 4 days old, as my youngest patient was, and go, right, okay, we're going to look at the back, because that's not what happens. And the same with a 90-year-old. It could be knees, it could be hips. There's varying degrees of things that happen, and we'll look at somebody literally from their feet to their head. One of the things that was interesting when I first started osteopathy or training was the fact that we were told that we do not cure people. We help people to cure themselves. But what with that is that we actually need people to help us to help them. Something else that we can do as osteopaths is that we can do referrals. So if somebody actually comes into us with either something that's really quite acute, and through our observation and our consultation, we believe that somebody would be better off for having some form of referral. So whether it's seeing a consultant or some form of imaging, we can write to a GP on their behalf. Or the other thing is we can go privately. So something that might need looking at, and ourselves as osteopaths might just need a little bit of help with some form of diagnosis or working diagnosis, is we can refer people on as long as it's us and the patient deem it's necessary for either x-rays, ultrasounds or MRIs, which is really helpful.